So before I enter the patient's room, I would verify the MD order, making sure that this patient needs the blood transfusion. So then I'll go ahead, knock on the patient's door. Hi, my name's Alex and I'm going to be your nurse for today. So today the doctor ordered a blood transfusion for you. So I would go ahead, wash my hands 20 seconds per CDC, put on a pair of clean gloves, making sure I have all of my supplies prior to coming into the room. So all my supplies would consist of a biohazard red bag, 500 cc's of normal saline, the blood that they need. So for my patient, as demonstration, would need AB positive blood, my IV tubing, an alcohol pad, normal saline flush, and then my gloves. So with this, then I would go ahead and then ask my patient, can you verify your name and date of birth for me? Then I would go ahead and then check their wristband, making sure that that matches up. And then I'm going to go ahead and then take vital signs. So I'm going to be taking heart and lung sounds. So with this, I would demonstrate on myself. So for my heart sounds, I would go ahead and then check their heart sounds in all 4 places. Okay, and then I would also check for lung sounds as well in all 6 places as well. And then after I've done that, so I would check their vital signs to making sure that I'm getting all my baseline vital signs. So then afterwards, once I'm done with the transfusion, I would also check vital signs as well to make sure that there's no adverse reactions. So then I would go ahead and then compare the patient data on the blood, and then check that on the order form, and then also on the blood band that's on my patient's arm. So then once I verify the blood band with the blood units, and then verify the blood unit with the request form, I'm going to go ahead and then request another nurse as a witness to please verify my RH compatibility with the blood, my blood units, and making sure that my patient's ready for the blood transfusion. So next I'm going to go ahead and then assure patency through the IV line. So I'll go ahead, clean the IV port for 15 seconds, and then letting that completely dry, and then assuring patency with the normal saline flush. And then after that, I'm going to go ahead and then place my normal saline on the pole. So once I have my normal saline on the pole, then I'm going to go ahead, grab my tubing. So once I got my tubing, I'm going to make sure that all of my IV clamps, all my IV tubing clamps are closed. So I would make sure to close my IV clamps. Once it's closed, then I can go ahead and then spike my spike my normal saline. So once I have that spiked, then I'm going to prime tubing all the way to the end of the IV line, and then close the normal saline roller clamp. And it must be clamped before my blood bag is spiked, otherwise it can cause contamination. So then I would also hang up my blood bag. Okay, so once my blood bag is up there, then I would open my blood roller clamp. Open up my blood roller clamp and then prime the tubing. Then I would go ahead and connect my IV tubing to my patient's IV access. So then I would connect that to my patient's IV. Ensuring that the blood is primed until the distal part of the IV tubing. So then I would get the pump to deliver. So I would go to the Alaris pump and then making sure that it's going no more than 30 milliliters per 15 minutes. And then after that, I would monitor my patient for any adverse reactions, if they're getting, if they're feeling like any chest pains, if they're getting like a fever, if they feel like they're having chills. So then after this, I would also measure my vital signs 15 minutes after my blood administration. So then if I need to increase my infusion rate, if that's what the prescription says, then I would have to do that. But if not, then I would go ahead and then measure the vital signs when everything's complete and when the blood transfusion has completely gone through. So once it's completely gone through, then I would go ahead and then disconnect my blood tubing. So disconnect my blood tubing. So after I've disconnected it, then I would go ahead and then flush my IV line with normal saline. So then once I flushed it, so the reason why I would flush my IV access port would be to administer any residual blood that's in the IV access port. So making sure that the patient's getting all of the blood that was in the bag. So then after that, then I would go ahead and then measure my vital signs one more time, making sure that the patient isn't experiencing any adverse reactions and that they're returning back to baseline vitals. So then after that, then I would go ahead and discard my tubing. Take it from my spiked bag, take out my normal saline, my blood, and then go ahead and then toss in my red bag. So once that's in my red bag, then I will go ahead and then clean up my patient's IV port, 15 seconds, let that dry, and then once I've discarded of everything, making sure that the patient's side rails are completely up. If they need anything, don't hesitate to call me, giving them their call light, putting their bed to the lowest height possible for patient safety, and I'll be right back. I'm just going to go document all of my findings and everything that we've done today for this procedure. And then discard of my gloves, perform proper hand hygiene for 20 seconds per CDC, and then yeah.